everyone. I'm Dr. Krista Burris, and I'm here with Coachella Valley Direct Primary Care on June 2nd, 2021, talking about a coronavirus update for the Coachella Valley. And I'd like to welcome all of you. Normally, I have my compatriot, Dr. Michael Kim, with us, but he has to take care of an emergency. And so today I am on my own. And hopefully I can give you the information that is applicable to today and discuss some of the current situations that we're in our local area, as well as the county, state, and country and world. So the good news is that our numbers here in California and Riverside County and the Valley have continued to stay flat. This week, our overall numbers are looking pretty good. This is a daily summary for yesterday for the whole county. And what you'll see here is that our new cases are really quite low at 31. We want to keep in mind that we've just come off of a holiday weekend, and what we normally see is a dip in cases right after that because the testing sites weren't doing as much testing over the weekend. So we may see what I would like to call some artificially low numbers for the next few days. And then towards the end of the week, like Thursday, Friday, we'll start to see where we really are. But I don't think it's much higher than this. I just want to sort of throw that out there. These numbers are a little low. And then if we go down to the bottom, we'll see that our positivity rate has stayed nice and low at that 1.3. Yes, last week I think we talked about the fact that it had trended upward a bit, but we're staying good. It's gone back down to the 1.3 range. And in the health quartile, which means looking at the most affected, least resourced 25% of our county. So that basically means our poorest communities are, they look at that rate to make sure that we're not having parts of our community that are being left behind in the progress. And their rate is 1.4. So really overall, these numbers look pretty solid. It does look like we're holding steady. We do know that we have had increasing movement, increasing people going out into the community, more people socializing, end of the year parties for schools, Memorial Day parties, people getting together, relaxation of mask regulations, and sort of a slow incremental increase in our vaccination rates. So we still remain at this position where we have about half of our population that's unvaccinated, and pretty low transmission rates currently, but much more interaction and contact with other people. So if we're going to see a summer bump, it's going to be showing up in about 2 weeks. So again, we'll keep an eye out, but in about 2 weeks is when we would see our case numbers start to rise. And in about 3 to 4 weeks is when we would see hospitalization start to rise. So we'll keep an eye on that just to make sure that we're not seeing a bump from this. Interesting enough, that correlates almost exactly with the timing for the June 15th sort of opening up of the whole state. And so it'll be interesting to see if there is a bump, if they delay that, or if they just go ahead and open up and hope for the best. But hopefully we won't see a big bump. Next slide is looking at the weekly numbers for the Coachella Valley, which is called District 4 in Riverside County. And you'll see here over the past week here in the Coachella Valley, there have been 82 cases and no deaths. And this is good news. The one area that I'm sort of keeping my eye on is our hospitalization rates, because those have sort of crept up a bit. It's not a super high number, but we were down in the 5, 6, 7 range here in the Coachella Valley, and now we're really averaging somewhere around 12. So we basically doubled our hospitalizations over the past week. This is not necessarily panic time yet. It's still a small number. It's still within the realm of possibly just chance that we've had these variations. So we'll just keep an eye on it again. Since our case numbers are remaining low, I'm hopeful that this is just a blip and it won't continue to go up, and we'll see that 12 come back down lower to the 5, 6 range. Also, our positivity rate is 1.5, slightly higher than our county average of 1.3. So again, something to kind of watch. Not a huge difference, but it's there nonetheless. So the next table I wanted to show you is one that can be a little overwhelming to look at, but what is very interesting about this is the current vaccination rates in different states. And it can be kind of interesting for people like me who like numbers to look at charts like this, because we see often trends or things that may explain why some areas may be more vulnerable still than others. And if you look here at the states at the top, these tend to be smaller northeastern states. They've done a very good job if you look at vaccinating their seniors. Some of these states are up around 90% of the over 65 population being vaccinated, which is amazing. But you'll see that when we hear these numbers about half the population has gotten a vaccine, really it doesn't necessarily mean half the people around you have gotten a vaccine. Depending on where you live, you could be in a state where 60 or 70% of the people around you have been vaccinated, or you could be in a state where only 20 or 30% of the people around you have been vaccinated. And that's a big difference. Some of those places are going to be much more high risk if we do have a surge either in the summer or the fall, and may actually repeat what happened last year. So we could actually have a situation where parts of the United States or even parts of states were doing really well while other parts were suffering a great deal with surges and deaths. So this is sort of a wake-up call for us. We have this nice little breathing room where it seems like things are going well, and it seems like maybe we don't even need to worry about vaccinating everyone. But in reality, this is like the eye of the hurricane. And if we really want to get all the way out of the pandemic, we have to continue to sort of keep up the pressure on the virus and keep up our vaccination efforts. There is going to be a federally sponsored push this month to try to increase our vaccination rates before July 4th. And so you'll probably see a lot of incentives, a lot of sort of advertising or marketing around trying to help people get vaccinated, lots of special vaccine clinics, moving the clinics out into the community more. And all of this is trying to take advantage of this kind of lull in the pandemic here in the United States before we get to a point where we're behind the 8 ball again and chasing a surge. So if you go down lower on this chart, you'll see that at the top, we've got these numbers of, population with at least one dose of like around 60, even up to 70%. But if we go down a little lower on the chart, you'll see that we've started to get now into the 40s. And then all the way at the bottom, you'll see that we still have some states that are really low 40s or even high 30s. So we have some areas of the country, especially in the southeast, that are really quite vulnerable still. And this is kind of nerve-wracking for people who have family there or loved ones there, that they still are at risk for kind of a hit if we do see a surge, which is possible always. So that's it for the charts. I wanted to talk a little bit about some of the concerns that people have around vaccination, some of which are based on really good thought, and some of which are based more on fears, I would say. But they all deserve some response, because I think they're legitimate concerns that people have. One of them is, when we first started talking about the mRNA vaccines, the Pfizer and Moderna, people heard how they worked and said, wait, what do you mean they're going into the genetic code? Are they altering people's DNA? What's happening with that vaccine? And so people got really, understandably, a little concerned about this. The thing about these vaccines is that they don't actually interact with the DNA in the cell. They don't go into the nucleus. They don't bind to DNA. They don't alter DNA. What they are is little instructions of mRNA. So messenger RNA is something that DNA makes. So basically what we're doing is, instead of altering the instruction manual, we're handing a wrench to the mechanic. So the instruction manual's there. It doesn't get changed. It's just the tool that they needed to work with. We're shortcutting the instruction manual and just telling them, you need this tool, here it is. So rather than having to go back to the DNA and read the instructions to make this, the messenger RNA is just being handed to the ribosome, and it's saying, make this protein. So that's the difference, and why it's not affecting our cell's DNA. It can't incorporate itself into our own genetic structure. Messenger RNA doesn't do that. It doesn't connect with DNA and get incorporated. There are other ways we utilize gene therapies that do that. And so I think sometimes, genetics is this sort of vague, esoteric kind of, magical thing. And so hearing, well, you can gene splice other things, or these people do genetic modified foods, or, are we genetically modifying ourselves? The answer is no. All we're doing is utilizing that shortcut to hand the ribosome the information they need to make the wrench, basically. So that is a concern that I've heard multiple times of, are these vaccines potentially going to cause us to have a problem down the road? And no is the answer, because it doesn't actually affect DNA. And then another concern that I hear a lot is worrying about being very sick, especially after the second shot, because we know that for some people, they can have enhanced side effects after that second shot. So some people are even afraid to get a second shot. They may get the first one, but then sort of put off that second one because they're really worried. Or they may have put it off so long, they think they need to restart and go back and get a first dose. And the answer to that second problem is no, you do not need to restart. Even if you had your first shot 3 or 4 months ago, you can still just get a second shot now. The concern about having more side effects, I think it's a natural concern. Still, most of the people, like the great majority of people, are not sick enough after that second dose to stay home from work or school. They may note arm soreness, and then a small subset may get a lot more symptoms, things like a fever or fatigue. This is something we like to warn people about so they don't worry if it happens to them. But it really isn't as common as people think. They're often planning to miss work, or, saying I can't do anything because I'm going to get my shot, or worried that they might go down for a week. That is by far the exception, but the rule is some arm soreness and maybe some muscle ache or fatigue, but not enough to actually cause people not to be able to do their normal activities. So I think it's a reasonable concern, and it's not, impossible that people will have more side effects, but the great majority of people don't have severe side effects. So that's one of the other things that, I talk with people a lot about their concerns, and it comes up. Probably a concern I don't hear very often, which kind of surprises me, is people aren't as worried about blood clots with the Johnson & Johnson, even after it was stopped for a while and then reintroduced. It's interesting to me what kind of gets picked up into the public realm. And it may have been that the discussion around the blood clot issue was so, nuanced, or it had too many medical terms or something, that people kind of, didn't pay as much attention to it. For me, this is more of a concern as a physician, to make sure I don't miss a potential complication if it comes in later. And then if I had a patient who had a underlying medical condition that increased their risks of clotting, I probably would steer them towards either Pfizer or Moderna rather than the Johnson & Johnson, just to avoid that potential very rare complication. And I honestly think that the sort of, failure to pay attention to this in the general public is probably a good thing, just because it is so rare, and we're looking at about 1 in a million of a risk. So it's not something that's really worth worrying about for the average person. But it definitely is worth thinking about if you're a doctor and your patient comes to you with a severe headache, 1 week after having a Johnson & Johnson vaccine. That is something I'm going to consider. So that's sort of the realm of concern. I've heard a lot of other concerns that people had about the vaccine being new. And again, I totally understand that. And in fact, in many times, I kind of feel like it's wise to wait and let other people go first, especially with new treatments, new medications. Sometimes I, even as a physician, like to wait a while before I prescribe something and just see sort of what happens in the general public. And I tend to weigh that against the risk benefit to the patient of not doing it. So in the case of vaccinations, I think we're currently at this situation where there's individual risk right now is fairly low because our community rates are kind of low. However, it's this, like I said before, this great window into an opportunity to just really put the nail in the coffin of the pandemic. So my advice is, if you've been waiting, now is a really good time. Now is the time for you to just say, you know what? We've had 100 million people get this vaccine. We've seen these extremely rare side effects. We've been able to pick them up, and I'm pretty confident there's not a whole lot more out there that's going to happen with this vaccine. I think we're good. So if you've been on the fence or kind of waiting, now's the time to go get it. because this is going to be our window to actually stop the pandemic, rather than just have a nice summer and then be right back into masking and close businesses next fall. So I don't know if I can urge you more than that, but that's my encouragement is, if you're on the fence, now's your chance. Go do it. And that's it for today. We'll be back next week. And it's been quite a year, and we really have appreciated all of our friends and family out there and encouragement.